Hi YouTube, my name is Victoria and I just recorded my very first vlog. It is a pregnancy vlog and I will link that below. This video I'm going to talk about the condition that I have called Uterus Didelphys. I mentioned it in my pregnancy vlog and I said I would do a separate video talking about it in more detail. So in this video I'll talk about how I was diagnosed and what it has meant for me in terms of getting pregnant and carrying my babies and labor and delivery of my two children. I'm pregnant right now, about 4 weeks, just over 4 weeks, with baby number 3. So I might do this in a couple of parts because it'll probably be pretty long because I'll focus on how I was diagnosed and then I'll talk about how it affected my two pregnancies. So if it gets a little bit long, I'll break it up into a couple different parts. So I was diagnosed about 8 years ago. I had gone for a colposcopy, which is like an advanced pap at the hospital because I'd had some abnormal cells, which is really common. Most women will have to go for an advanced pap at some point in their lives. And I'd been for at least 2 of these before. And so I was just there for the routine check and the doctor's doing her thing, and she kind of stopped and said, "You have 2 cervixes." And then she said, no, you don't. And then she said, no, you do. And I just remember saying, I feel like I'm on an episode of Grey's Anatomy because there's an episode where this condition is featured and the girl's actually pregnant in both uteruses by 2 different men, I think, due at different times. So it's pretty extreme, although I do think that theoretically can happen. I don't know if it really ever has. So I just remember joking about that. And so she kind of explained the condition to me. And what happens is when you're developing inside your mother, normally the reproductive organs start out separately and fuse together. Sometimes they don't completely fuse and that results in a bicornuate uterus, which most people have probably heard about. It's fairly common. So like a heart shape. So instead of a pear, it's like a heart, and the dip at the top can be small, or for some women it's very deep. So I have like the most extreme version of that because the septum goes all the way down. So I have completely 2 separate uteruses, 2 separate cervixes, and a septum that divides the vagina into 2 halves. I only have the normal 2 ovaries and 2 fallopian tubes. So each uterus has its own tube and ovary. And I also have a horseshoe kidney, which often comes with having this condition. So it's like 2 kidneys attached together in like a horseshoe shape. So that's sort of how things develop. And I never really had any indication that maybe something was weird. In hindsight, my periods were irregular, but I know that's fairly common. I had trouble with tampons in that they never really worked 100%. I always had to use a panty liner at the same time. But again, maybe I thought that was normal. It's not something you really talk about with your friends. And that was really about it. I never had any issues with sex. Everything felt normal. I never had severe periods or anything, which can be common with the condition. So when I was diagnosed, I was, pretty shocked, and I'd never heard of this before other than, I guess, on that episode of Grey's Anatomy. So I was sent from this OB for a ultrasound and an MRI and a second opinion at a hospital that specializes in women's issues in another province. And after that, I met with my OB and we talked about the results, and it was confirmed that I did have uterus didelphys. I had 2 of everything. And at that point, they didn't recommend doing anything about it. And I still have never had anything done about the condition. Sometimes they will do surgery to remove the septum in the vagina because it can get in the way during sex and can cause it to be painful, or it can prevent pregnancy or delay pregnancy a lot because if the septum, sometimes one of the sides is quite small, so you only have sex on one side, and then if you're ovulating from the other side, the egg and the sperm don't meet, so sometimes they'll remove the septum for that reason. But my septum, I guess, is quite thin and filmy, so it, I think, moves out of the way. I know some women can completely feel both sides. I've never been able to do that. And because some women, their septum is like thicker and more like more tissue, sort of like the septum in your nose, but mine is quite thin. So it's never really caused me any issues. So at that point, they didn't recommend any treatment or anything. We talked about what it could mean for pregnancy, and I remember this part so clearly. The doctor drawing a question mark on the page and putting a circle around it and saying, we really don't know. When the time comes, we'll see. Some of the things that can commonly happen with this condition is it can take longer to get pregnant because, like I said, if you're only having sex on one side and you're ovulating on the other, things don't meet. Then you're at higher risk for the uterus not growing properly because they're often smaller, and babies are often breech, so higher risk of C-section. And the biggest one, and the one that I resulted in my second child being born prematurely, is the cervix can become incompetent or shorter. So that's why I'm monitored monthly from about 20 weeks on, just to check on the cervix and make sure that it's staying long and closed. So those are the main concerns with pregnancy with this condition. And I'll say right now that I know I am completely blessed and so lucky and so fortunate that I have been able to get pregnant very easily 3 times now. I know people who have no medical conditions that take months and years to be able to conceive, and how lucky we are is not lost on me for 1 second. I say my prayers and thank God every day for how lucky we have been to be able to conceive so easily, because I know the stress that I've seen friends go through, and I just can't imagine. And I say prayers for them every day and hope that they will be blessed like we have been. So I just want to say that I know that we are very, very lucky and rare that we've been able to get pregnant really easily for all of our babies. So I think I'll stop this part here, and then I will do part 2 about my son, and possibly I might break it up into another part for my daughter. So I will link those below, and please feel free to ask any questions, any comments, any tips on the video, and I will get back to you. Hopefully you've enjoyed this and found it a little bit informative, and it's probably something a lot of you have never heard of before. I will talk to you in my next video. Bye.